The following program is rated GE. It is suitable for general family viewing.
Hello and welcome to yet another episode of Body Garage here on TV 47 with I, Sheila Chelangat. And on this episode, we focus on breast cancer. As you know, the Breast Cancer Awareness Month is marked every October each year, a global campaign that aims to improve support as well as screening for the disease. And with me in studio are some breast cancer warriors who actually preach hope as well as advocate for screening. Hi guys.
Hi.
How are you doing this day? All right, so we begin with Terry, who will tell us her little testimony or sort of experience since getting diagnosed with breast cancer.
I was diagnosed with breast cancer in 2016, and in the course of my self-test, I found a lump under the nipple of my right breast, and it shocked me, yes. And I decided to give it at least a week to see maybe it is something that will disappear. And I waited, a week is gone, the lump is still there, not painful, it was painless, it's not moving at all. And that is when I decided to go to the hospital. I went to a normal casualty. I didn't go to any specialist direct, but I went to casualty. Okay. And when I went to casualty, and this was the specialist, he sent me for the mammogram, and he could see it from the mammogram. And after that, he sent me for the biopsy. And when the biopsy report came out, it wasn't clear at all, because the biopsy said it might be cancerous, it might not. And now the specialist, when I took back the report, he said, no, there is no report here. So he told me, send you back to the minor theater, go and see the surgeon, and you remove that lump. And the lump itself was taken to the lab. Now that is what gave out the result that it is a cancerous lump. All
right, Terry, thank you for that sharing. And of course, as usual, we normally have a doctor on set. Tonight we are joined by Dr. Premas Ocheng. How are you, doctor?
I'm well.
All right. Now, I know we delved right into breast cancer, but this year the theme is actually, no one should be left behind, and no one should face breast cancer alone. How relevant is that theme to breast cancer?
So the theme is very relevant for many reasons. One is that breast cancer is the number one cancer that affects people in Kenya. And so if you look at the total number of people with the breast, so it's the most common. Most common in the female, not in the male. Usually when you go to hospital, most ladies tend to go to the hospital alone. But of course, in breast cancer, we have seen many of the female coming together with their men. So this just reaffirms that we need to encourage more men to help them. Another thing is that when people get cancer, they go through a lot of psychological torture in their mind, because cancer is one of the diseases which for some time was associated like HIV with death. And none of us want to die. We know it's natural that one day we'll have to go and to visit God, but we never think that it will ever happen.
Yes.
So with the science today, many people live with breast cancer. So when people hear the word cancer, they tend to get scared that, oh, death is knocking the door. And so if you have somebody walking along with you, that person can help you share that thought, that person can encourage you, and that person can make you think that actually it is still okay, we can still walk the journey and we are together. You don't want to die alone anyway. No, you always want to die with somebody. And we all believe when we die, we still go to God. We never just disappear. Yeah, so in many ways, it's always good that a disease like cancer, which is very scaring, which requires a lot of support, we walk with somebody.
Walk with somebody.
Yes.
All right. So for the layman, how would you explain what is breast cancer?
So breast cancer is cancer, and cancer is like any other sickness. And breast is a very important organ in both man and woman, but much more in the women. Be you an animal, be you a human being. It is a swelling usually found in the upper part of the body. It's there both in the men and in the women. The men, it does very little work. But in the women, it plays a very important thing in that it is what feeds an infant after one is born. So when you are born, you come from the womb, you are fed by the mother, and then it takes a period of time when you still cannot be able to feed on the food that you have. You need to still being fed by your mom from outside. And that's where breast become very important, because it is the source of milk that will feed a baby for at least 6 months. Say first 2 months, then after that we start introducing food little by little, but still goes on up to the 6th month. And so it's very essential that without that, it will be very difficult for one to survive. Now, suppose we say these days we have milk, which is artificial milk. The baby coming from the mother still is growing. They don't have immunity. They don't have the bonding. So the breast is not just the food, but it also provides immunity. It provides essential stuff which allow the baby to grow, the baby to become bonded, the baby to see that is part of being a human being to grow. So all this come through the milk, and the milk is from the breast. And that's why the breast is very important for all of us.
Okay.
And sometimes, by bad luck, it is one of the organs which tend to get more cancer than any other organ part of the body.
Why
for
is
the
that?
women. For the men, where it doesn't play a very big role, it also gets cancer, but much, much less. Yes.
As you speak about that, are there ages where the cancer starts?
Yes. So for a long time in the history of humanity, up to about the 1980s, cancer was associated with old age, and a few were associated with very early age. So young children would get cancer, and most of it was the blood cancer called the leukemia, and the old people will get different cancers depending on other factors where they stay. But now things started changing from the 80s to the 90s, that now cancers become a problem of all age. And if we go specifically to breast cancer, we find that most people who get breast cancer in our setup is majority between women between the age of 40 to the age of 55. That seems to be a little the opposite of what they see in America and in Europe, where most of their women get breast cancer at the age of about 55 going to 75. And because of this now, 40 to 55 is a very vulnerable age, because that's the age when many people are working, people are starting their careers, people are actually senior managers, people need to be giving birth, people need to be contributing significantly to the population. So we're seeing that this is a disease or a cancer which seems to be disrupt people's life significantly, because the treatment also tend to take long.
All right. Are there any risk factors?
Yes, so as we are going to talk to our warriors who have actually gone through. So there are risk factors, but in the clinic, the people we see, they never tell you they have a risk factor. If there are risk factors, they are very, very few. But you know, being a woman makes you have a risk factor, and then having your periods when you are a bit earlier, probably earlier than 13 years, and then having your menopause when you're a bit older, about 55 years, that tend to make people have breast cancer. We also think that the women who have not been breastfeeding, give birth and don't breastfeed, or those who have very few kids who have never breastfed, tend to have a breast cancer more than the ones who have not been. Say those who don't exercise a lot tend to have breast cancer. Those who are big, naturally big. We don't say fat these days, we say big. And so those who tend to be big are also more prone to getting breast cancer than those who tend to be smaller. And then those who use a lot of contraceptives, that could also be able to put them at risk of developing breast cancer, those who smoke. But in the clinic, most of the people, we ask them, they're slim. They said, I've used contraceptive here and there, and then they didn't get it. But they also say that the biggest risk factor is your mother, your sister, having a breast cancer put you at a very, very high risk than anybody else.
Okay. Now, someone is at risk. What are some of the physical symptoms that actually show themselves?
So as I said before, is that it takes cancer to develop. So you have a very long period when changes are taking place in you, and you cannot be able to actually see it or feel it. And in anything, most people with breast cancer will tell you they either picked it accidentally or they picked it when they were checked with scans. It was never painful. They didn't see much change. And because of that, therefore, symptoms of breast cancer usually is you feel a lump in the breast. But some people may never feel a lump in the breast. They may feel a lump after the armpit, because those are the glands which supply the breast. Some people may only come to hospital and they find they have breast cancer if they say have their bone broken. So the cancer moved from the breast and went somewhere silently without having any problem in the breast. Some may get kidney failure because it has damaged the bones and damaged the kidneys as well. Some come with problems like they are mad, are sneaked into the brain and making them feel like that. So the symptoms are never that common, but the common symptoms is a lump in the breast. Most people feel it accidentally. Or changes in the breast which are picked when you go for screening. And that's where now the screening comes very important.
All right. And at this point, Daktari, let's get to listen from our breast cancer warriors on some of the symptoms that maybe they did encounter before they were diagnosed. And all of us are wearing the pink ribbon, which is a symbol for the awareness and support of breast cancer. Let's begin with Catherine. How are you? And what are some of the symptoms that perhaps you noticed with yourself?
Hi, Sheila. For me, I was doing my breast self-examination. I did that every month. And that's when one time I found a lump and wondering what was it doing there. You see, so that's one of the symptoms that, and the lump wasn't moving. It was stagnant. It wasn't painful. So I really didn't think much of it. But then after some time, gradually, every day I would touch it and wondering what is it still doing there. So I eventually decided to go and have a checkup. And had the test, the FNA, which is a fine needle aspiration, which was inconclusive. And then they decided to do a biopsy, having the lump removed. And then that's when the results came out that I actually had breast cancer. That was 20 years ago.
All right.
Yeah.
Wow. So it was just the lump for you?
For me, it was just the lump.
Okay.
Yeah.
All right. Let's also listen from Maggie. How are you? And perhaps what were some of the symptoms you experienced?
Thanks for having me. I had no any symptom. I was not feeling anything. Actually, it was like normal, like any other girl. But what happened, it was on a Sunday evening after shower. I just put my hand in my breast and I felt something. I was like, what is this? I ran immediately to the mirror. I began doing the exercise that we've been taught to do. I couldn't find anything. But then immediately my spirit told me, rush to the hospital the next day. So that's what I did. I find doctor and I asked, do you do breast tests? The doctor said yes. She was like telling me, I feel something here that need an extra diagnosed. I'm like, what are you saying? What is this that you are feeling me? I'm studying. I can't feel anything.
Yes, yeah.
I was telling the doctor, even I can shake my body. The breast is moving. So what is this? So the doctor kept telling me, yeah, there is something here that need a special diagnosis. Go and do ultrasound. So I decided to go and do ultrasound. I did it. She told me you need to do mammogram.
Yes.
It hit me. What is mammogram? What is ultrasound?
Yes.
Be in mind, all my year I have never been sick. So this is my first time to go to hospital. You are telling me to do a mammogram. What is this? So I was shocked. I asked the doctor, would you explain to me exactly what do you mean? She had to tell me, sit here, I show you in my laptop, what is this? So we have done this ultrasound, do mammogram. because we want to be sure what is this thing that we have found. Yeah.
All right, Maggie. And that is interesting, Daktari, that she had no symptoms. And so as even we take our first commercial break, we will be back and let Daktari explain, is it possible that you might not experience any symptoms and then finally find out that you actually have a breast cancer? So stay tuned for more. But first, let me leave you with our facts and myths board of the day. Breast cancer is more common in women with bigger breasts. There is no connection between breast size and cancer risk, although it can sometimes be more challenging to examine larger breasts. Breast cancer can only affect middle-aged or older women. While most cases of breast cancer do occur in middle-aged or older women, a breast cancer diagnosis can happen at any age or any time. Breast pain is a definite sign of breast cancer. Breast pain is usually not a sign of breast cancer, though it should not be ruled out completely. The most common symptom of breast cancer is a new breast lump, though most lumps themselves are not cancerous or painful. Welcome back. This is Body Garage with me, Sheila Chelangat, as we delve into breast cancer, knowing that the Breast Cancer Awareness Month is every October each year. And with us in studio are some breast cancer warriors who are preaching hope as well as advocating for screening, as well as Dr. Primus Ocheng, who is helping us to delve deeper into breast cancer. Daktari, just before the break, we were speaking with Maggie. She says she had no symptoms at all. It is just by her faith that she went to hospital. Is that possible?
Yes, that is possible. Remember, God created all of us with a very powerful sense called the sixth sense.
Yes.
So your sixth sense will tell you, don't follow here. If you follow here, things will go wrong. And it happens if you follow them. Yeah, so that's why, again, we go back to something called the mammogram. So mammogram can be able to actually see changes in the breast which suggest cancer, such that even if you touch your breast feel normal. There will be changes which look like just a string, and the radiologist can be able to interpret that there is actually changes starting as cancer. And that's why we like to use mammogram to be able to make a diagnosis of cancer which you would have not made by the patient feeling it, the doctor feeling it. Yeah, then the ultrasound can also be able to pick even small little changes which if you feel, your breast will not be able to actually pick them using your hand. So that is true. Some people will actually be able to have small changes which only tests can be able to pick.
Okay.
But in our case, I think there was a lump, but since, you are not a doctor, and also more often than not, when you have something which is a lump, you really don't think it is a cancer. You think cancer belongs to them. The lump is for them and not for me. And so you, in your mind, when you feel the small little thing in your breast, you just think, anyway, it is normal, but the doctor is going to confirm it to me. But even when the doctor is confirming it to me, the confirmation is that it's a normal thing. Remember, that is how we are wired always, that the problem is theirs, the problem is not mine, until the science prove that actually it is the cancer. So that happens.
Okay. And when we are talking about this lump, how big of a lump is it? Because sometimes you might touch your breast, but then you feel the, what do we call them?
Yeah, actually all breasts,
Yes.
except the one for the men. The ladies' breasts usually are lumpy. It is never very, very, very smooth. But as one is that if it is a breast which needs something to be done, fine thing is that it will be bigger than the other lumps. That's why it will be bringing your attention there. Tend to be a little bigger than the other lamps. The other lamps are small. Most of the time, they're actually mobile. Rarely do you find them fixed. By the time it is getting fixed, it's quite close to the skin. And then the other thing is that this lamp might grow, but you might not be able to feel it. It grows over a period of time. The other lamps will come, disappear. Most lamps change in their sizes and shape depending on the time of your menstrual cycle. During the menstrual cycle, most lamps will clog together. The breast become more lumpy and increase in size. So that time it will be very difficult to tell the lamp. But this is a lamp which you feel it is bigger than the other lamps. It tends to stay there and increases in size over time. Rarely do we get the lamp get painful, even if it's cancerous. Yes.
Okay. And someone was asking, can hormonal contraceptives lead to breast cancer?
Yes, so there have been a feeling that there are certain cancers which are driven or the growth is accelerated by the hormones. And we feel that if you use the hormones for very, very long, for those cancers which feed on the hormone, actually can put you at risk of breast cancer. And so mostly the tablet that people use puts people at actually breast cancer if you have those hormones, cancers which tend to be feeding on the hormones. Yeah.
What about the emergency pills, P2?
Yes, so that has been a big discussion all over the world, that the emergency pill, we think strongly that the emergency pill also put people at risk because even the level or the hormone, the amount of the hormones that are usually put in them is higher than the normal. And therefore, it gives your body a very high surge in terms of the hormone in the body, which can actually make the cells become accelerated in growth, and then you end up with cancer. Yeah.
All right. So for someone that now has spotted the lamp and comes to your office, what are some of the methods of diagnosis? Once someone is at your desk, how would you diagnose them?
So usually the first thing a doctor needs to do is to reassure the patient, because a lump is not cancer. And you say that if you have 10 people with lumps, only one of them turn to be cancer, because the anxiety when you confirm that it is a lump, the mind of the patient usually it is cancer. Yeah, so the first thing is that you'll have to check the patient, take the history. Okay, first of all, take the history, find out whether their family members have history of cancer, or they have used the contraceptives, the age, and then you run through, examine them and find where the lump is, and then take them to the lab, take them to the X-ray place where you can do ultrasound, mammogram, depending on the size of the lump. Mammogram actually gives you more information and can be able to classify for you the lumps which more cancerous and the lumps which look less cancerous. And then after that, then a biopsy is taken, which is just a piece of that lump taken to the laboratory, and that's usually which confirms that there's cancerous cell. And that's when you now can then break the bad news to the patient or the client that actually we have cancer. And then the next stage now is check has it spread or not. And then do other hormone tests, because before we used to think all breast cancers are the same, and today we have 4 different types of breast cancers. And treatment are different, as probably we are going to talk about. So the approaches are different, and then the outcome of their treatment are also different. Yes.
All right. Perhaps you could touch on those types of breast cancers. What are they?
Yeah, so there's one type which we say it is estrogen receptor positive, and we call it HER2 negative. This tend to take a little older age women. It tends to grow very slowly. Then we have one which is called a triple negative. We find it more in the younger women. It does not have any what we call the receptors. And that is determined by the pathologist. And again, it tends to grow a little rapid. Sometimes by the time you are picking it, you find the whole breast is full of the cancerous cells, or sometimes it makes the breast look like somebody has passed inside. It can also go to other parts of the body. And this treatment is mainly to use chemotherapy most of the time. And then we have other type, which is called the HER2 overexpress. And this also tend to behave like the luminal A. And this type tend to actually, we use certain targeted treatment called the Herceptin. Many people now know. And Herceptin is used together with the chemotherapy to treat it. And then we could have the one which is now a luminal A, but it's a little different in that its estrogen receptors are not very strong. and then that one we classified differently. It tends not to grow very rapidly, tend to grow a little slower. It tends to behave like the estrogen receptor type, and again the treatment is a little different. Yes.
All right.
So we don't treat the same. Now, when I started treating or joined training to become an oncologist in about 2008, in Kenya we treated all ladies the same. So you get a lump, the surgeon will remove the whole breast.
Yes.
Then after that, we'll give everybody chemotherapy. After that, we give everybody radiotherapy. After that, then you give people hormone treatment. And we didn't do any tests. All we needed was confirmation of cancer. But we realized that outcomes were different. And then from about 2010 onwards, the classification changed. And that's how we now come up with about 4 types of cancers now.
Okay, we will get to that, Dr. as you discuss to us about the treatment as well as the management. But first, let's get to hear from Anita. How were you diagnosed, and what was the feeling at that point?
Good evening. I took myself to hospital, but not because of cancer. I was just unwell. So when I went through the whole process of A&E, saw a doctor, went to do a blood test, then was sent to the lab. Then I was coming back to the doctors now to get my diagnosis and be sent to the lab to get my medication. So while I was there, I did one of those, oh, by the way, Daktari, I've been feeling like a thing over here. It was a by the way. I had felt it like 6 months before. Prior to that, my sister also had a lump, but it was not cancerous. So she just had a lumpectomy. It was removed. So I had asked her, what did you feel when you had the lump? And she kept telling me, go see a doctor. Don't ask me questions. So I never did. So even by the time I was going to the doctors, I had forgotten about it. It was a by the way. So then, as in the doctor was like, this is not a by the way. So he told me, okay, lie down, called a nurse, checked, and they did feel the lump. Immediately sent me for a mammogram. You fill a form when you're doing the mammogram, and they ask you several questions. And one of the questions is there discharge? Yeah. And what color of discharge? Of course, I said not applicable, cancelled, all those. So the radiologist asked me, so why did you say no? I said, but there's no discharge. So she said, have you pressed? I'm like, no. So she said, press. So when I pressed, some mucus looking brown thing like jumped out, and I was like, I was like so scared. So I had to change the form and say, yes, this discharge, what color? That was the first time I was scared. I was so terrified. So we did the mammogram. She gave me the results and told me, go back to your doctor. I'm like, which doctor? I was at an A&E of a hospital. Where do I go back? So the confusion started there. Talked, of course, the first person is my husband, who I called. And we decided, after a bit of confusion, we thought, let me see the gyna. In 2016, we didn't have breast oncologists, or even oncologists at the top of our heads. Now we can tell you, go to so-and-so, go to so-and-so. We didn't. So then we didn't know what to do. So I went to my gyna, and he looked at the results. Of course, we had done all the diagnoses ourselves. Had seen I'm grade 5. So we knew you can read some of the things and it's not very good. He looked at it and he immediately picked his phone and called a breast surgeon, his friend. And I was booked in for the next day. Mm-hmm. I think for me that was a done deal.
Okay.
And he sent me it was in the night. He sent me for pap smear. He sent me for a scan, uterus scan. So at that point, by the time he's fast forwarding all these things, I knew. And then after that, after we saw the surgeon the next day, he did a biopsy immediately. And now I waited for the longest 1 week of my life for the results. Yes. And well, when it came, he told me, well, what we've been fearing for has come. It's cancer. Mm-hmm. It's HER2 positive. Uh-huh. It's at that point, it was stage 2, grade 5, progressing to stage 3. At that point, he checked my lymph nodes. Didn't seem to have, but by the time I was going into hospital a month later, I had 19 lymph nodes as well.
Oh, okay.
I had to have 19 lymph nodes removed.
That's quite a journey, really, Anita. All right, let's get to also hear from Anne. Hi.
Hi, good evening.
Good evening.
My name is Han.
I was diagnosed in 2021. About myself, there was a lump in my left breast, and I decided to go to hospital because I was not sure what was it. So when I get to hospital, I found a good doctor who told me about to check on ultrasound. After that, I go to a mammogram. Then after a mammogram, she advised me to go for biopsy. Then I waited for the results, and the results came that it was cancerous.
For how long did you wait for the results?
Around 2 weeks, 2 to 3 weeks there.
And in those weeks, how was the feeling like?
It wasn't good. In fact, I was so stressed because I didn't know what was it. But the results came that I was cancerous. And from there, I started the other tests and treatment.
Okay.
Yes.
All right, thank you, Anne. Daktari, when we had Anita, she said that, once she was diagnosed, it was even hard to think at the top of her head, who could be the breast doctor she would go to. So what is the situation like in the country as of now? And in terms of breast cancer, what do the statistics look like?
So the statistics now say the breast cancer is the #1 most common cancer. And we're talking about 7,000 women with breast cancer. But we think that this is an underestimation. Because everywhere you go, we find so many women with breast cancer being attended to all hospitals. In terms of the number of generally cancer care in this country has really changed in the last 10 years. This is where we have seen lots of investment both in the government and in the private. And we can say that the government has invested quite a lot in this country in terms of cancer treatment, more than most African countries. And Sub-Sahara, I think we are ahead of everybody. And even in terms of breast, take breast, mammogram. Every county has a mammogram machine, a county hospital, and then you can go to the private hospital. Maybe some counties that are not being used because we don't have the radiologists, the doctors who actually read it. In terms of cancer center, we have actually registered about 58 cancer centers in the country. So that means we have even more cancer centers in certain counties than one. So that means if you are saying Kakamega, you can get treated. Number of oncologists, about 2016, there were about 10. Today, there are about 68.
Yes.
And in the last 3-4 years, we have started training oncologists now. We had about 1 or 2 breast surgeons. Now I think we're about 8, 9 there.
Okay.
Doctors who are specially trained to only handle operation for the breast.
And these 9 serve the whole country.
They still have the whole country. So we're still struggling to increase the numbers. Unfortunately, that kind of specialty, one has to go abroad, and it's quite expensive to train doctors abroad because they're only mainly trained in the developed country, Europe. So it requires probably like 5-10 million to train for about 2 years. Yes, but at least now that there are also the local surgeons have now been trained by the few who are trained to do surgery. So you can be done a breast operation very successfully, say in Kakamega or in Turkana. Yes.
All right, Daktari, those are the strides that us as a country are making in terms of breast cancer treatment. And so we take a short commercial break at this point, but when we will be back, we will deal with now what is the treatment and is breast cancer really preventable, as well as listening to the breast warriors who are with us here in studio talk about now living positively once they have been diagnosed with breast cancer. Do not go too far. We'll be right back. you for staying with us. This is Body Garage with myself, Sheila Chelangat. And just before the break, we have already touched on some of the symptoms that you might be likely to feel in terms of breast cancer, as well as the diagnosis methods that doctors do use once you get to their desks. Now, Daktari, perhaps what are some of the treatment and management methods that you advise your patients?
We make the diagnosis and we have staged you, and we say you are either stage 1, stage 2, stage 3 or stage 4. Then the treatment is designed based on the stage. Old days, if you are stage 3, stage 4, we treated you less. Today, we treat everybody almost the same. We put the same effort to treat everybody so that people can live with cancer. So our aim of treatment is to make one live with the cancer, the way people live with high blood pressure, the way people live with diabetes, the way people live with asthma. So stage help us on deciding on that. So I said before that now, these days again, breast cancer is not one disease, it is different diseases. So once we know like one is HER2 positive, you are triple negative, you are what we call luminal A or luminal B, or you have your estrogen receptor positive, and then your stage, then we decide. So the main four form of treatment, one is to remove the lump. Yeah, the lump should come out. The cancer should come out, because we believe that when the cancer come out, we may remove it all. If you don't remove it all and you leave something inside, then it can go to other parts of the body. And the other thing is that cancer tend to move from one place to another. Even when we have removed it all, it can potentially remain, and we may not be able to see it with naked eyes or see it with the test that we do. We need to clean the body, and that's why people go through either chemotherapy, target therapy, or hormonotherapy. Even when the doctors removed everything there, we still have research has shown that there could be a chance that cancer can still come back. And when it comes back, it starts from where it started from. And that's when our radiation come in, where then we give you radiotherapy, what people call kuchoma. We add local treatment there, like what operation did, to make sure that everything which could have been hidden that we didn't see is sorted out. Yeah, so that's generally how we treat. So once we group you into the 4 groups, then we treat you according to that. Now, these days for stage 1 and stage 2, generally, if you are hormone positive, we can remove it out and then give you the other treatment. If you are the triple negative type, we know it works very fast, or HER2 positive these days. Even if you are still stage 1 or stage 2, we tend to give people chemotherapy upward to clean the body, because they have high chances of spread, and thereafter the doctor then remove it. For stage 4, we tend to try very much to control the tumor, because the tumors come from the breast and goes elsewhere. And whatever goes elsewhere, if we don't take care of it, it can grow and damage and cause complications there. And so the aim of the treatment usually is to start with either chemotherapy, hormone, or targeted therapy, so that we control whatever is far and whatever is there with the chemo or whatever targeted therapy we have now. But the thing people should know is that we have passed that age where stage 4 was treated like you're dying tomorrow. Today, the stage 4 is treated like we are walking the journey with you. And we have a lot of drugs and a lot of targeted treatment available. The only thing is usually the cost, because the more modern and better now, the more expensive they are. We have drugs which actually go as expensive as 1 million per month. Now again, when you are stage 4, the treatment like continues every day, the way we treat most diabetics, like every day.
So it is expensive.
Very
Someone
expensive.
who's at stage 4.
Exactly. It's more expensive if you are stage 4 than if you are stage 1 and stage 2.
Okay. And at what point do you as the doctor then advise that, let's get rid of the breast?
Yes, so one, even stage 4, there are certain stage 4 which still we can advocate for it to come out. People only think stage 4, we only give the chemo, and other treatment. But we can also even stage 4. If, say, it is bleeding, if, say, it is form like wound there, which is not healing, we may actually advise a stage 4 to do operation. Yes.
Okay. And this treatment is the same as if you were treating a man?
Yes. So the treatments are man and women again. We just classify you and stage you and treat you the same way.
Okay.
Though a lot of the men treatment is from the way we treat the women, because there are few, so we can't do big research to find out whether is this the actually correct treatment for them. Yeah, because research is what form the basis of the way we treat.
Okay, Daktari, thank you for that. Now let's get to listen from Rachel. Uweze tu kutuelezea ulipo sasa umekuwa diagnosed, treatment sasa yako ikawa ni vipi?
Mimi nilianza treatment yangu 2021 na daktari akaandika nifanye chemotherapy 8. Ine zikawa za red, hizi ine zikawa kama ni majimaji hivi. So after hapo nilifanyiwa surgery. Hiyo ni mwaka wa 2022 Januari na nikafanyiwa radiotherapy mwezi wa 4 mwaka huo. Alafu nikaambiwa sasa nitarudi after 2 months, na kweli nikarudi na nikapewa dawa ya kumeza, nikaandikiwa tena kurudi after 3 months. So wakati nilirudi after hiyo 3 months niliandikiwa ingine 6 months. Nashukuru madaktari wetu kwa sababu huwa wanatuambia ukisikia uko na mabadiliko yoyote kwa mwili, hata kama tarehe zenye umeandikiwa hazijafika, ni vyema urudi hospitali. So mimi nilijihisi hapa hivi nikiwa na kakitutu kachembe kadogo kama kamchele hivi hapa kwa kwapa langu penye nilikuwa nimetolewa titi. Na nikarudi na ikawa ni mambo ya kuanza kufanyiwa, nilitumwa nikafanye ultrasound. After hapo niliambiwa nipige picha. So nilifaulu kufanyiwa hiyo biopsy December last year, date 27. Na matokeo ilitokea kwamba nimeathirika tena na ugonjwa wa saratani ya matiti, na nikaweza kulazwa tarehe 20 nikalazwa tarehe 8, samahani, nikalazwa tarehe 8 mwezi wa 2, na tarehe 9 nikaweza kupoteza hili titi ingine la left. Okay. Hivi sasa nashukuru Mungu kwa sababu naendelea na matibabu. Nilibadilishiwa, sikuweko chemotherapy kama yenye nilikuwa napewa. Daktari alisema ni vyema ni dungwe shindani, ambaye shindani ni shindani kubwa sana, inakujanga kama iko packed. Ni refu sana, sijaiona shindani kama hiyo. So nilikuwa na dungo 250 grams saidi ya nyuma pande hii na pande hii ingine. Nimeendelea na hiyo, nikaambiwa kwamba nitatibiwa after 2 weeks. After 2 weeks naenda na dungo hiyo shindani. After 2 weeks naenda na dungo hiyo shindani kwa muda wa mwezi moja. Sasa ndio nikaambiwa nitaendelea kufanya nini, nitaendelea kwenda sasa after 1 month. Hapa hivi kwa shingo langu kuna uvimbe ilikuwa pale kidogo na ikaendelea kukua. So far nimedungwa hizo shindani 6 ambazo nimepewa chemotherapy 6 ambayo kuna shindani 2 kwa kila kemo. Niliweza kuambia daktari wangu, kwa sababu niko na hii kitu ya kusahau sana. Niliweza kuambia daktari wangu venye nimefura shingo tena, na alipoangalia akaona kweli kuna uvimbe. So akaniambia hiyo dawa yenye napokea haifai kama naipokea uvimbe iendelee kunini, sababu kwa PET scan walikuwa wameiona nilikuwa nimepigwa PET scan.
Okay.
Kwa hivyo niliandikiwa tena nikuje nifanye biopsy, nirudi hospitali nifanywe biopsy. Lakini wakaniambia nitaendelea na hiyo kemo ya kudungwa. Hii biopsy chenye itatokezea ndio sasa watachukua mwelekeo mwingine. Yeah.
All right. And I would like to hear from Nancy and Jacqueline. How is it living with, positively with breast cancer? How would you, advocate and preach hope to somebody who has just discovered that they might be having breast cancer in about 30 seconds? Jacqueline, Nancy.
Thank you, Sheila. My name is Nancy Chebet. I want to speak to every woman that the time you are diagnosed with breast cancer, it doesn't mean you are going to die the following day. It is just a myth that you might die, but When you fight and you go through treatment, the way we went through treatment, you are not going to die. I have 12 years of surviving breast cancer, and I've survived the aggressive type, the triple negative. So go to hospital, be treated, you will be okay, and you live long. Thank you.
Absolutely, absolutely. Truly, there is hope, Daktari, even after getting diagnosed with breast cancer. That is the message that we are getting from our breast cancer warriors who are with us in studio, and they keep to preach hope as well as advocate for test for every other woman. Daktari, in less than 30 seconds, what are your closing remarks?
All women need to go for screening because Mammo and all the screening tests are there. Breast cancer is not breast cancer. You have to look for it to get it. And this treatment, you can't live with it, whether you are stage 1, stage 3, stage 4. All you need is to be treated, and treatment works.
Thank you so much, Dr. Prema Sucheng. We loved it having you here on set, as well as our breast cancer warriors. Do clap you for yourselves. You have done extremely well. And the message today is that no one should face breast cancer alone. And there is hope that you will get treatment even after getting diagnosed with breast cancer. Thank you for watching this episode today with me, Sheila Chelangat. We shall see you next week. But first, let me leave you with the health tip of the day. Avoid becoming overweight. Obesity raises the risk of breast cancer after menopause, the time of life when breast cancer most often occurs. Embrace a diet high in vegetable and fruit and low in sugared drinks, refined carbohydrates and fatty foods. Eat lean protein such as fish or chicken breast and eat red meat in moderation. Physical activity, even when begun later in life, reduces overall breast cancer risk by at least 10%. All it takes is moderate exercise like a 30-minute walk 5 days a week to get this protective effect.